Hello everyone. First of all, I'd just like to say that I'm very grateful to be here and to be able to present my work to you. My topic is decreasing the relinquishment of owned dogs by implementing behavior modification therapy. As a doctor of veterinary medicine, I work with owners on a day-to-day basis in overcoming behavior problems by conducting behavior modification therapy, and I'm doing this by speaking loud and clear, not whispering. Firstly, why are we talking about behavior modification? Because today we have more and more evidence that behavior problems are the most frequently given reason for relinquishment of owned dogs. This further illuminates the need for understanding of behavior problems. Also, behavior modification therapy is a form of responsible ownership, because the owner, if a dog has a problem, he has to provide a professional help, and this decreases the likelihood of a dog being abandoned. Also, this reduces a conflict between owner and a dog. This study was conducted in my Pet and Science Educational Center, which is my so to speak, a way to overcome the lack of information that the owners have about behavior and behavior problems that dogs and cats can have. The data set consisted of 50 canine records. 3 were medical, and 47 of those canine records that I had were behavioral. The most common behavioral disorders that I had of those 47 cases were aggression towards people, mostly fear-based aggression, fear of various things, destructiveness in the house, aggression towards animals, also linked to aggression towards people, which is also fear-based aggression, mostly due to inadequate socialization, biting, excessive vocalization, which are the forms of attention-seeking behavior, problems between new pets and other pets, which is bad management, leash aggression, and general disobedience. In those 47 cases, after my assessment and plan for treatment, 15 owners refused the treatment and 32 accepted the treatment. The refusal, which is always, I ask the owners why they're refusing the treatment. The first reason was finances, which is understandable in some way. The finances in my country are a very big issue. I can relate to the owners in that way, but there are some cases where the owner is claiming that he doesn't have any finances for behavior modification therapy, but his dog is sitting next to me with a Swarovski leash. So this is something that I will never be able to understand. But this is due to lack of information and education in that field. The second one, unable to find time, which I find that very useful, because I like when the owner says that to me, because he's just being honest. He's just saying to me, I don't have time for this, thank you very much, but that's it. And the third one, my personal favorite, not believing in treatment, which I blame bad TV. In those 32 cases, in 7 cases the treatment was half completed. In 25 cases the treatment was fully completed. In those 7 cases when the treatment was half completed, the first part of the behavior modification therapy was completed, but the second part, where we have to sustain the new behavior which we implemented, the owner is free to just say, okay, this is enough, I don't have many more finances, this is enough for me, I'm going to do the work on my own, so on and so on. Which I find is very important, because the owner said that the problem became manageable for him. It was good enough, as they stated, so also they didn't consider relinquishment anymore, so we have to say that it's a success. In those 25 cases where the treatment was fully completed, I had all positive outcome, which is quite remarkable, but I'll come back to that later. The reason was because the owner stuck to the program, and as a result, the dog did no longer exhibit problem behavior, and also the relinquishment was no longer an option. This is very useful to talk about cost and benefit for this kind of work. When we talk about it, we have to look at three important indicators. First one is time, second one finances, and the third one outcome. Time factor. We have to be aware that behavior modification therapy is often time consuming, and it can take up to 6 months to a whole year in order to treat a problem. And also this is closely related to finances, because the bigger the problem, the bigger the expenses, so also this is also a time factor. The third one, outcome. Also the more severe problem, the outcome is often unknown. So we have to be very careful when giving the assessment of a problem and when giving a prognosis. Cost and benefit analysis for this study in particular, cases weren't difficult, and this is the reason for this is because in my country owners don't have a clue about behavior modification therapy. They don't know anything about behavior of dogs, so they think that even if a dog is just jumping sometimes on them, this is some sort of a big problem and they need a year or 2 or 3 to address to it. In this study, the therapy was conducted in a short time span, up to mostly 2 months. So the expenses were reasonable, the outcome was positive. So the benefits outweighs the costs in this study, which I think will not be the case if I had more difficult cases. In a conclusion, we can say that relation between cost and benefit depends mostly on the severity of the case. The longer the therapy lasts, the cost outweighs the benefit. So as I said before, we need to give realistic prognosis and we need to give realistic assessment. So I often ask myself, should we take in any case? Or should we be realistic and say, okay, your problem is appearing for a long time, your dog is, I don't know, 10 years old, so on, so on. So do we need to take in any case, or should we be realistic and say to the owner the thing as it is? Also, I found that giving some advice and explanation of the problem to the owner made him change his mind. Of those at the beginning, when I said how many of them refused the treatment, they refused the treatment after I talked to them. And they called me back after 2 or 3 months and they said, we did not relinquish the dog is still with us, because when we talked to you, you, as they say, opened our eyes. Now we understand the problem, now we know why the dog is doing this. He is not doing this to spite us or to take over the world or something like that. He's just being a dog and we didn't understand him, now we do. So again, education and right information. We know that animal behavior problems often have detrimental effects on the relationship between pets and owners, and therefore I think that we need to implement some sort of an intervention strategy for educating the owners. And my conclusion will be that education in this field, educating the owners about the behavior of the dog, is something that will prevent relinquishment by, I think, 80%. That's it. Thank you for your attention.